Good afternoon. My name is Jose Arbayo, spokesman for the Riverside County Health Department. Since January 28th, when Riverside County learned a plane carrying passengers would be arriving from China, we have been planning for the possibility coronavirus could spread into the United States. Part of that planning involved preparing Riverside County hospitals that would serve the many patients that would need treatment for COVID-19. I want to introduce two physicians that have been directly involved in preparing our health system for the anticipated surge on the county's hospitals. They have a stark message for Riverside County residents as we prepare for the expected strain on the system. Dr. Geoffrey Leung is head of ambulatory care for Riverside County and a medical advisor for the county's response to the pandemic. Dr. Michael Mesisca, head of emergency medicine for Riverside County University Health System. Before they speak, Supervisor V. Manuel Perez, chairman of the County Board of Supervisors, has a message for the community.
Thank you, Jose. On behalf of my colleagues, the supervisors of Riverside County, all our districts, Vice Chair Karen Spiegel, Supervisor Geoffrey, Supervisor Washington, Supervisor Hewitt, myself representing the 4th District as the Chair, Victor Manuel Perez. My message to all of you, ladies and gentlemen, is to take this coronavirus seriously. Yesterday, our nation suffered the passing of over 1,000 individuals from coronavirus in 24 hours. And my condolences goes out to the families of those, as well as the families of those individuals that have passed as a result of the coronavirus here in Riverside County. And our condolences goes out to our sheriffs, our 2 deputies that have passed, one this morning and another deputy as of yesterday. We ask you, ladies and gentlemen, to stay in place, to maintain your space, and to cover your face. And if you noticed, I'm wearing a bandana, I'm not wearing a mask. And the reason I'm wearing a bandana, or you can wear a scarf, is because we're doing everything we can to provide those masks to our first responders and to the individuals that are in the front lines and making sure that they're taking care of patients. But we also are asking you to consistently social distance yourself 6 feet away from others, and to continuously wash your hands, obviously to cover your face when you sneeze and cough. You will hear from Dr. Leung, and he'll be speaking on how we're going to flatten the curve, and he's going to provide numbers and modeling. Dr. Mesisca, who's going to speak on the surge as well, but the collaboration efforts that are taking place throughout the county of Riverside, that's unprecedented. From Dr. Flowers, who will be speaking on donations and the need for volunteers. We also have Dr. McCafferty from Desert Care Network that's going to help us with answering questions from folks that are calling in. I want to thank the National Guard for constructing the federal medical site, for helping out with Find Food Bank and food distribution. I want to thank the county team for all the good work that they're doing, from legal counsel and making sure that we have the facts up on the website, and our RUHS team, our local hospitals, our clinics, our emergency management services, public health, my staff, everyone that's coming together to make sure that we defeat this virus. And once again, this virus does not discriminate, ladies and gentlemen. It could be a youngster, it could be a young adult, it could be a middle-aged individual, or someone in their golden years. We need to take this seriously, and we ask you once again to stay in your place, to maintain your space, and cover your face. And with that, I'm going to ask Dr. Leung to come up to the podium. Thank you.
Thank you, Supervisor. We've heard that California COVID-19 cases may be slowing down, but that is not what we are seeing in Riverside County. In Riverside County, our cases continue to rise exponentially, and we have very little time to turn this around and prevent an impending surge. Despite all of our best efforts, we are still on track to have as many as 65,000 cases, over 11,000 hospitalizations, and over 1,000 deaths from COVID-19 by the beginning of May. 1,000 deaths is a lot of people. If you think about all the people that you meet in an entire year, and if all of them were to die, this is the number of deaths that we're expecting by the beginning of May if nothing changes. 11,000 hospitalizations is also a lot of people. If you imagine the Staples Center during the basketball season, if half of those individuals were in a hospital bed, that's the equivalent of what we're expecting for hospitalizations by the beginning of May. And that is 3 to 4 times the capacity that we currently have for hospital beds. This is just for Riverside County. In addition to staying at home and washing our hands, we believe there are 4 more things that we can do to help slow down the spread of COVID-19. They include covering the face, testing, closure of non-essential businesses and places of gathering, and enforcement. With regard to covering the face, our public health officer, Dr. Kaiser, recommended on March 31st that all individuals in Riverside County wear a cover for the face whenever leaving the home. This newest recommendation is to help protect those around us and to decrease the spread of infection, especially now that we know that COVID-19 can be spread by asymptomatic individuals. Everyone at grocery stores, at your work, if you're an essential worker, or outside, should be covering the face. And if you see someone who does not have their face covered, please kindly remind that individual that we have a new recommendation in Riverside County to cover the face to help keep everybody healthy. If we can do one of these things well, either testing or covering the face, making sure that all places are closed, or enforcement, we believe we can decrease the number of cases and deaths by 50%. If we can do 3 of these things well, we believe we can decrease the hospitalizations, the cases, and the deaths by 75%, saving nearly 700 or 800 lives or more. But we have to do them well, and we have to do them now, because we have very little time left before the impending surge. The hard work of flattening the curve in Riverside County will largely come down to all of the small decisions that each individual makes each day. Thank you for helping us flatten the curve and prevent the surge. With that, I'd like to go ahead and introduce our medical director for the operations branch, Dr. Mike Mesisca.
I'm going to briefly remove this because I want to make sure that our message gets across very clearly. Thank you for joining us this afternoon. And I am going to be sharing some data, some information, and some pictures with you that we have not previously shown before in our county. And so before I get to that, I'd like to introduce and demonstrate the team behind me here. So as a part of our mission with this team is that we have 2 promises and commitments, and we are committed as one united healthcare front to provide the highest level and quality of care that we possibly can to our community. And second, we are here committed together to protect our hospitals and our healthcare workers. As one of them, we understand the stress that this puts on our families of healthcare workers and on our healthcare team that's going into the hospital right now to face this threat to our community. Behind me here, I'd like to introduce a number of our team members. So Jen Cruikshank, the CEO of RUHS, Dr. Frank Flowers, former area medical director for Kaiser Permanente and currently serving as the medical liaison to our operations team. Jared McNaughton from IEHP is our CEO of IEHP. Linda Evans, the chief strategy officer of Desert Care Network and representing the Coachella Valley. Brad Neat, standing behind me here, is the vice president of UHS for Southern California. Dr. Randall McCafferty is a neurosurgeon at Desert Regional Medical Center and is the clinical lead for the Coachella Valley, and Vita Willett, our Senior Vice President for Kaiser Permanente, and we've heard Supervisor Perez speak already. Why it's so important to me that this group of individuals is behind us is that we have assembled a team here like nothing we've ever seen in Riverside County. They represent a smaller portion of our team because many of the others are working in our hospitals and preparing for this currently. But the united front that we've assembled that transcends any healthcare system, any insurance provision, is here today working together well in advance, but now as we fight this virus in our community, to come together to assemble an army of healthcare workers. Here to support you, our community, to support our doctors, our nurses, our RTs, our physician assistants, our nurse practitioners, our radiology techs, the entire team in the hospital behind us and on this county. There is a massive team behind you supporting you. Before I go further and talk about surge, I do want to express a very heartfelt and deep sadness that we feel for all of you in this county and beyond that have lost lives related to the COVID virus. And in particular, to our sheriff's family. Our law enforcement partners, our brothers and sisters, they are a part of this family, a part of this county, and we all are deeply saddened, but we are with you in this fight, and we will do everything possible within our power to continue to support you and protect you. Next, to our community, a big thank you. To those of you that have listened to us and have taken the advice that our public health department, that our board of supervisors, our county CEO, we have been begging many of you throughout the county to stay home, to wash your hands, to cover your face, to stay in place, to maintain your space. This war will be won by 1 million small and large decisions. And many of you are following those. You're making good decisions. We've seen a 50% reduction in movement based upon cell phone data within our county. But we still have much further to go. Other counties have seen a 70% reduction, and that's to Dr. Leung's point, is that we have not gone far enough at taking the advice that we've provided. And so we beg you today. But again, a thank you to those of you that have taken the advice. We've seen a 20 to 40% reduction in our emergency department activity and a 15% reduction in 911 calls. So thank you. But to those who continue to work who are non-essential, who gather at churches, at home, at parks, please stop. We beg you. Small decisions, though they seem, will lead to deaths by the hundreds and thousands. Perhaps 2,000 or more in this county alone. As Dr. Leung said, we meet 1,000 people every year. Imagine that. Everyone that you've met this year alone in the hospital and dying. These are not just numbers on a graph or data points at a news conference. These are lives that we are losing. These are parents, husbands, wives, our children, our friends, our neighbors that will die. Our healthcare and law enforcement teams carry this burden. Every day we leave to work, our families worry about us. Every day we return home, we worry what we might be bringing back into our homes. So please stay home. Wash your hands, cover your face, maintain your space. The reality is, this virus is brutal, and this will be hard to hear. 1 out of every 20 people infected will get critically ill. On between day 5 and 10, for those that get critically ill, the infection spreads throughout the lungs. The lung itself fills with fluid and cells. The oxygen that we apply, if we have to put in a breathing tube, will not be able to oxygenate the lungs. It won't transfer in. Your lungs are like a sponge. You put them into a sink, they can absorb water, you release it. In this case, when it fills with this water, with this cell, with this debris, with the virus, even as we apply oxygen in this small percentage of the population, there won't be enough oxygen to get into the lungs and go to the heart and to the brain. I have a picture here. You can see a normal chest x-ray on one side where the lungs are nice and dark colored. That's where the oxygen is. And on the other side, you see an actual patient from our own county where the lungs have filled with that fluid and that debris, depriving the body of necessary oxygen. Again, I know this is hard to hear, which is why we've waited to this point to deliver this message. Our intention is not to cause panic. It's not to put in an unnecessary fear into people. I'm told that fear in and of itself, that many of you might shut down and not hear the message, but please hear this. Dr. Leung has convinced me it's not too late. It may be a matter of days that those small decisions can cause a drastic change to limit the number of times that my doctors and my nurses have to see this. And it gets worse. Besides the sickness and the illness is the way the death happens in our hospitals. We can't allow visitors. We can't protect the family members of people that get to this point. It's horrendous for our doctors, our nurses, our respiratory therapists, and for the entire team. This massive burden of illness will also stress the entire system. If you're thinking, I'm young, I'm healthy, I don't have to worry about this, I want you to think again. If the numbers that Dr. Leung has expressed, our ability to deliver medical care to people that are presenting with other issues will also be challenged. There will be delays, there will be bad outcomes. The threat is not just the virus to older people, it's to everyone in our community. And my message to our healthcare team, thank you for your courage and confidence. We love you. The team behind me represents the leadership and other physicians that are here to support you, that have been supporting you. And please know that all 17 acute care hospitals share in the message that I'm delivering. I have talked to every single one of them, their CEOs and their CMOs. This is a united front like this country has never seen before to fight this war, to protect you. You are our family, your family is our family, and we are working as one Riverside County healthcare team. Our surge plan is developed and growing. It's incredibly impressive. We have shared it with other counties who are using it as a model. There's 5 phases to it. We are in phase 3 right now. We are preparing for phase 4 and 5. Phase 4 is a phase that expands our hospitals much like the H1N1 outbreak, where we are able to expand our ICUs and our acute care, but we stay within the confines of our licensed bed capacity. Phase 5 is a whole different surge, but our hospitals are moving in that direction together as one front. That's where we begin to plan for an addition 6,000 or more beds within our county that extends beyond our normal treatment areas in our buildings. We are aggressively acquiring staff, equipment, and space to grow our hospitals. We have organized communication with every hospital and their leaders throughout the region and throughout the county. But we recognize that there are critical gaps in our armor to fight this war. We know what they are and we're fighting to fix them. Our plan focuses on staffing, equipment, and space. Our 17 acute care hospitals, along with our Riverside Emergency Operations Command, with 400 plus members strong, our teams in planning, operations, and logistics are tirelessly working to get us the equipment, ventilators, protective equipment, and staff. With respect to staffing, we have people returning, people that have retired from our hospitals, that have moved out into clinic space, that are signing up and getting credentialed to come join this fight. Imagine that, the threat that I shared with you to healthcare, and yet people are clamoring to join us, to support you in the community. It's amazing. We have non-acute care staff. I'll give you an example. Our pediatricians and our orthopedists have offered to come into the emergency department and support our ER doctors. We're seeing that type of outreach throughout the entire health system. With respect to staffing, we have, as I mentioned, retirees. We have people working in clinics that are coming to join the force. To our healthcare community, and this is a message to you, if you work in the healthcare community and you're not currently attached to a hospital, we want you to volunteer. Please go to the county's public health website, and there's a link there that you can click on to volunteer. That's www.rivcoph.org/coronavirus, and on the top right corner is an opportunity to join this team. With respect to equipment, we know we have several critical areas. We know we have a shortage of ventilators, and we are anticipating that shortage to hit in early May. We have purchases submitted by hospitals in the county to suppliers, and every day we're chasing new leads. We have requests out to the state pending more ventilators. To our surgery centers, we need your ventilators. To our industrial business, we need PAPRs and capers. If you have it, we want it now. Again, please go to our website and click on donate. With respect to space, we've already tripled our ICU capacity, and we have plans to go further with that. And I can talk more about that if there's questions. Our goal as 17 hospitals and as an army of county leaders is to meet your needs through 100 small victories. Our message today together, when one hospital wins, we all win. We are sharing best practices through conferences, we are sharing strategies and resource ideas, and we will continue to support every healthcare team member throughout our county. You could not ask for a better team to support you than what this county has assembled. It's incredible. I'm incredibly proud. I'm incredibly honored to be able to stand here and to represent them and to represent the healthcare team we have throughout this county, throughout our hospitals, our emergency rooms, our intensive care units that are rising together to support our community. Again, thank you. Thank you to those that are staying home, that are maintaining your space, that are washing your hands, that are covering your face. To every member of our healthcare and law enforcement teams, thank you. To your families who worry about you, we thank you. We will get through this together. One fight, one team. Thank you.
Thank you to Dr. Leung and Dr. Mesisca and our supervisor for the messages. We now will be taking questions via the phone. Brooke Federico will help us out there with the coordination.
Okay, operator, we're ready for our first question.
Yes, ma'am. If you would like to ask a question, please press *1 and record your name. And the first question comes from Peter. Your line is open.
Hi, yes, I'm calling from News Channel 3 here in Palm Desert. We're curious, are you concerned there could be multiple surges?
Yeah, so I think that's critical as to why we need to keep the shelter in place or stay-at-home message in place. And so that's the whole point of slowing this. There are concerns as well. We certainly are concerned about the progression of that, which is why we need to be very much on top of this. So I think if we take a tighter approach today and adhere to this message, it will slow the progression down and will prevent recurrences. If we continue to sort of linger and only follow this partially, then there is a much greater likelihood that we'll see peaks and valleys throughout this. So in essence, if we want to get back to work and get our businesses back up and running, then it's those little small decisions today that will keep us from having to deal with this over a much longer period of time.
Okay, operator, we're ready for our next question.
Yes, ma'am. The next question is from Ed Mendoza. Your line is open.
Yes, hi. This is Eric calling from Telemundo Channel 52, and I'll ask the question in English, but if anybody speaks Spanish, just wanted to see if you could repeat in Spanish the projection for Riverside County as far as numbers, and I know you mentioned that in other counties you guys have been seeing there's being a reduced number, but in Riverside County there's a spike. What do you...
Hi. This is Telemundo Canal 52. How can I help you? Is this Mr. John?
No, this is Dr. Dr.
All right,
Leung
go
will
ahead.
answer his question right now. Are there more than one line open? Because we had a question
go
from
ahead.
Eric Mendoza.
It would be coming from his line. I'm not sure if he's sharing a line.
Yeah, sorry about that. A colleague jumped on the line. But yeah, the question was just if you could talk about the projections in Spanish and as far as if you guys were expecting to see a spike in the county and what message for the Latino community in Spanish from Riverside County.
Pues, aunque hay personas que han dicho que en California los casos de coronavirus no están subiendo tan rápidamente. En el condado de Riverside, nosotros vemos algo diferente. Todavía está subiendo muy rápidamente. Y expectamos, si no cambia, que al principio de mayo, que posiblemente tendremos más que 1,000 personas muertes, más que 11,000 personas internados y más que 65,000 casos de coronavirus.
Buen hecho, doctor. Miren, tenemos que tomar todo esto en serio. Yo sé también que tenemos fiestas y la gente quiere salir, las quinceañeras, ¿verdad? Pero a este punto ya es necesario que uno tenga esa responsabilidad social. Nos tenemos que cuidar nosotros mismos, ¿verdad? Es importante que uno se quede en su casa. Si no tiene que salir, no salgan. Si es esencial, porque tiene que ir a comprar comida para la casa, para la familia, si uno tiene que ir para medicina, una farmacia, eso es entendido. Si uno está trabajando en un trabajo esencial, eso es entendido. Pero esos números van a seguir creciendo. Y van a seguir creciendo en cualquier comunidad. Pero si nosotros, como latinos, por ejemplo, no nos cuidamos, va a impactar muchísimo a la gente latina. Porque ya también sabemos que hay mucha gente de bajos recursos, hay mucha gente que no tiene acceso a servicios de salud, hay falta de transportación, ¿verdad? Hay muchas cosas que pueden impactar. Pero eso es muy, muy, muy importante. Se queden en casa, si no tienen que salir, no salgan. La distancia social de 6 pies. Y también hay que cubrir la boca y la nariz, ¿verdad? Por ejemplo, como yo tengo este paño, no tengo una máscara, tengo un paño. Es lo que yo estoy usando. Uno también lo puede hacer.
Okay, operator, we're ready for our next question.
Ma'am, there are no further questions.
One question, when you go out today, you see a lot more masks, but not everyone's wearing a mask. A little more detail on when you should be wearing a mask.
So we recommend that whenever you leave the household or the home, that you wear something to cover your face. That is for everything that you can think of, whether it's going to the grocery store, the pharmacy, going to work if you're an essential worker, or if you need to go visit an older relative. In all of those cases, we recommend wearing something to cover the face.
This is a little more in the details, but if we're seeing more tests happening all over, you're seeing a lot more cases go up, or is it more important to pay attention to the deaths as far as to see what track we're on as far as success?
So I think testing is critically important. It's like the pulse of the patient. It gives us a really good indication of what's going on. And managing that testing is one of the reasons that we feel that we have a more dire potential outbreak coming in our county, is because compared to some other areas that may not be testing as much, that it's factoring into those predictions. And so it's a combination. It's both of those data points, tracking both the death rate and tracking the tests in the conversion rate of testing to positive, that we can use both of those as measures as this projection in the modeling that Dr. Leung's used.
I was going to ask a little more detail on the slide that talks about the stacking of different methods of prevention and how that affects over time results.
In looking at countries that have successfully flattened the curve for COVID-19, places like China, Japan, South Korea, or places like Taiwan and Hong Kong, we've been able to learn what are the types of things that can help a place be successful. And those 4 strategies, again, include things like testing, covering the face, making sure that you've closed all non-essential businesses as well as places of gathering, and then finally, enforcement. We believe that if we can do one of those 4 things really well, we can slow the doubling time of the infection by 2 days, meaning that right now, if we're averaging a doubling time of 4.7 days, we could increase it to 6.7 days. If we can do 2 of those things well, we think we can increase that doubling time or slow it down by 4 days. And if we can do 3 of those things well, we believe we can slow it down by 6 more days. By adding 6 more days to the current rate of 4.7 days, that puts us into the double digits. And that gets us close to being able to flatten the curve, which is why we think we need to do at least 3 of those things very well to be able to rapidly decrease the cases and prevent a surge.
Brooke, is there anything more, Brooke?
Operator, are there any other questions on the line?
There was one, but no, she disconnected. No, I'm showing no questions.
Okay, thank you so much.
Very good. We'd like to thank you for watching today. Remember to keep up with the latest news on our coronavirus page. That's rivcoph.org/coronavirus. We'll get you the latest information. And thank you very much once again. Be safe out there.